If you're on drugs, you're on medication and you don't understand the dosage of the drugs, please ask whether as an inpatient or an outpatient. Outpatient means you are sick, you went to the hospital and drugs were given to you to go home with them and take the drugs at home, or you were admitted, you got well and drugs were given to you to go home and complete your medication at home. Please, in fact, before leaving that spot where the drugs were given to you, go through the dosage of the drugs, go through the prescription, make sure you understand whatever is written on that drugs on how to take it. If you don't understand, do not feel shy to ask. It is your right to know how you're supposed to take your prescription, how you're supposed to take the drugs you are given. No healthcare personnel will say no to explaining how you're going to take your drugs in a way you understand. So do not feel shy asking, because we discover that many patients go home with their drugs without understanding how to take the drugs. Maybe because they were shy asking for explanation, or they will just go and base their prescription on assumption. Maybe they say, this medication is yellow. I've taken yellow medication before and it should be taken one morning, one night, or two morning, two night. You're basing your prescription on assumption, which it is not right. If you don't understand, do not feel shy, ask for explanation. It is going to explain in a term you will understand, because if you don't understand how you're going to take your drugs, you may either undertake the drugs or you overdose the drugs. By taking underdosage, for example, you're supposed to take two morning, two afternoon, and two night, and you didn't understand it, you took two morning, two night. By then you've undertaken the drugs, that is underdosage. Therefore, that drugs will not work effective on whatever you're using it to treat. Then if you overtake it, you're supposed to take one morning, one afternoon, and one night. You now took two in the morning, two in the afternoon, and two at night. You're taking overdosage, and it comes with serious side effects. It comes with serious constipation, which may affect your liver, your kidney, or any other organs in your body. So this is why it is very important for you to ask for explanation on how you're supposed to take your drugs. There are some drugs that should be taken before meal. There are some drugs that should be taken with meal. There are some drugs that should be taken after meal. There are some drugs that should be taken at night. So that is why you need to ask whosoever is dispensing that drugs to you, please explain in a way I understand. I don't understand how to take these drugs, so as your treatment will work effectively. So whenever you are giving drugs, the first thing you should do, before leaving that spot is going through the dosage very well, making sure you understood whatever is written there. You are not a medical personnel. Some hospital may use some medical terms you may not understand. So that is the reason why you should go through the prescription. So whatever terms you don't understand, whatever is written on that envelope, that drug envelope that you don't understand, please ask for clarity. Ask. It is your right to know how to take your drugs. So stop going home with drugs that you don't understand the dosage. And please stop assuming you are supposed to take this drug twice. You're supposed to take it three times. You're supposed to take it two times. No. There is no need for assumption here. Even if you leave that spot without understanding, you went to your house and you forgot how to take it, please, it's either you call the facility or you go back to understand how you're going to take the drugs. If you take your drugs rightly, it is going to work perfectly well on you. But if you don't take it rightly, it's not going to work as it is supposed to.